Hi, I'm Nisha,
Hi, I'm Chloe.
and in this video we are going to be showing you how to test the 12 cranial nerves.
So these tests are important for diagnosing neurological conditions.
So the first cranial nerve is the olfactory. So the olfactory nerve is responsible for your sense of smell. So how to test this nerve is you take two containers and fill one with coffee and one with vanilla. Okay, so I have the two test tubes here. So I will bring them to the patient and ask them what they smell. But first, the patient has to close their eyes. So we will check each nostril one at a time. So I'll take the first test tube first. Can you close your nostril? Okay, smell. Okay, what does it smell like?
Coffee,
Okay, how about this?
vanilla,
Okay, so the other nostril. So close the other one. Okay, okay.
coffee,
Okay.
vanilla.
Okay, so the patient smelled both of these right, so that means there's no impairment on the olfactory nerve. Okay.
So the second nerve that we will be testing is the optic nerve, and the function of this nerve is for the sense of sight. So to conduct this test, I will ask the patient to close one eye. So we will be testing the eye that is not closed, and I will also close my eye so that our eyes are aligned, and then I will test the peripheral vision of the patient. So I'll put my hand up at the middle distance between the patient and me, and then I will slowly move it. And I will notice how the eyeball of the patient moves. So the patient's eyeball can move to the side, so she has no issues with peripheral vision, and her optic nerve has no impairments. So this is how the eye moves in checking peripheral vision, and we will repeat this test for the other eye as well.
So the next test is we are going to be testing three cranial nerves altogether, which is the oculomotor, trochlea, and abducens nerve. So these three nerves basically moves the eye, and they are all purely motor. Okay, so to test these three nerves, we need a flashlight. So then we take the flashlight, we move from the temporal side to the front of the pupil. Okay. So here and then to the front. And then you look at the pupil whether it constricts or not. If the pupil constricts when the light directly hits it, then the three nerves has no impairment. Okay, so this is a closer view. So when I move from the temporal side and then to the pupil, you can see that the pupil will constrict briskly when the light directly hits it. Okay.
So the next test is to test cranial nerve 5, which is the trigeminal nerve. So this nerve is responsible for face sensation, but it is a sensory and motor nerve. So to perform this test will test both sensory and motor aspects. So I will use a thread or a piece of cotton, and I will instruct the patient to look up and away from me. Then I will approach the patient laterally and gently touch the cornea of the patient without touching their eyelashes. So what we should look out for is a blinking response. This is the normal response, and as the patient is blinking, there's no impairment of this nerve.
So the next nerve we will be testing is the facial nerve, which is the seventh cranial nerve. And this nerve is responsible for your facial expressions. So to test this nerve, basically you just ask the patient to do some facial expressions. Okay, so you ask the patient to raise or lower your eyebrows. Okay. Then shut your eyes tightly. Okay. Smile with showing your teeth. Okay. Then last, try to puff out your cheeks. Okay. So you can see that the patient can do all the facial expressions that I asked them to do. So basically there's no impairment on the facial nerve.
So next we'll be testing the 8th cranial nerve, which is the vestibulocochlear nerve. So this nerve has two branches, the vestibular branch, which is responsible for balance and equilibrium, and also the cochlear branch, which is responsible for hearing. So the vestibular branch is not usually tested unless the patient has abnormalities such as vertigo and nystagmus. So to conduct the auditory assessment of hearing, I will close one of the patient's ears and I will test the other one. So I will recite a number and the patient has to repeat the number, but I will whisper it so it is softer.
14. 57.
And I will repeat the test for the other ear.
39. 50.
Okay, so there's no impairment to the vestibulocochlear nerve.
So the next nerves we are going to be testing is the 9 and 10 nerves, which is the glossopharyngeal and vagus. We are testing these two nerves together because they are similar in function. They both are responsible for your swallowing. So basically how you test these two nerves is you ask the patient to open their mouth and ask them to go ah. Okay. So basically you have to look at the palate, which is superior to the uvula, and then it has to rise promptly and symmetrically. So if no abnormalities when the patient opens their mouth, then it means there's no impairment to the 9 and 10 nerves. Okay, can you go ah? Okay, so there you can see that the palate is moving normally. So there's no impairment.
So the next nerve we'll be testing is the 11th cranial nerve, which is spinal accessory nerve. So this nerve is responsible for motor motions and it innervates the sternocleidomastoid muscle and trapezius, the upper trapezius. So in this test, we will be testing the strength of the trapezius. So I will ask the patient to shrug their shoulders up and I will see if the speed of the shrugging is similar and to the same extent. I will observe to see if the shoulders rise at the same speed. And after that, I will test for the strength of the trapezius muscle. So I will ask the patient to shrug their shoulders while applying resistance. Relax. Okay, so there are no signs of weakness of the trapezius muscle, so there is no impairment to the spinal accessory nerve.
So the last nerve we will be testing is the 12th cranial nerve, which is the hypoglossal nerve, and this nerve is responsible for your tongue movements. So this nerve is a purely motor nerve. How we test this nerve is basically first we ask the patient to bring out their tongue, and then we see if the midline of the tongue is aligned with the in between of the two front teeth. So I can see that it is aligned, and then we ask the patient to use their tongue and push their cheek out. So, and then we add resistance. Okay, relax. So if the patient has no issues on pushing their cheek out with the resistance that I add, so it means the patient has no impairment on the hypoglossal nerve. Okay, that's all from us.
Hope you all learned something from this video.
Bye.
Bye.